Meagan, thank you so much for joining us. Meagan has been Damien's PT for about 2 years. Is that you were his PT for 2 years? Is that right? I think so.
Yep, just over 2 years, just under 2 years around there. Yeah.
At the Smile Center. And sadly, Meagan moved on to a new position. And so we miss you so much. But I definitely wanted you to be the one to talk about PT because you've been Damien's physical therapist for so long. And you have had such a significant, amazing impact on him. Damien went from not even using a walker. So because of you, he started using a walker, which helped him so much to be able to play and go to the park and splash in the water. And then he graduated to quad canes. And now from quad canes, he's walking without anything. He still goes back to using the walker from time to time, but he's able to walk independently, and it's just been such an amazing journey and progress. So thank you. So if you can just talk
Well, thank
about
you guys because it was great working with him too.
if you wouldn't mind, tell us a little bit about your background, what led you into this field, what led you into NDT. Just tell us how you found your way into becoming the great physical therapist that you are.
Oh, well, thank you. Yeah, so I decided I wanted to be a physical therapist in like high school. I ran growing up, so I ran cross country and track, and I found myself in PT a lot throughout the years, and that kind of
Oh,
like
he's gonna get the
made me
camera.
interested in like how the body works and how I can recover and how I can make myself a better athlete. So that really like drew me into it, and I went into PT school, and I was like, I'm gonna work with athletes like me, and I'm gonna work in outpatient ortho, and that's kind of really what I wanted to do, which I think is what most kids going into PT school want to do. And I didn't really have any interest in peds, to be honest. My sister is also a physical therapist, and she was like, I'm going to do pediatrics. And now we're opposites. I do peds, she does not. Um, but when I was in school, I was like, maybe I'll give it a try. I went on a service trip my second year of grad school to Haiti with a few of my classmates. And we worked with kids with like a bunch of different diagnoses and adults with neurological disorders and a bunch of different things. But that was really my first experience working with pediatrics. Just kind of got like thrown into it. And I remember I felt like I had no idea what I was doing, but just within that like short week being there, I felt like we made such an impact on these families and these kids. And it got me really like interested in thinking about working with pediatrics. So when I got back, I like told our instructor, I was like, I think I want to do like my last internship in peds and like see how it goes, just give it a try. Um, so I did a 12-week internship at like a small pediatric hospital in Washington, D.C. And I got to see like inpatient, was in the NICU, little like inpatient rehab, and then some outpatient too. So I got to see a little bit of everything. And that was the first time I was like, this is definitely what I want to do. Like coming home from the internship, I felt like I loved going to work every day and just like playing with the kids and bringing so much joy to them and the families. And you really feel like you're making such a difference. I mean, you make a difference with adults too, but it's just a different kind of work. And I love just building the relationship over, I was only there for 12 weeks, but over that time. And that was just a really special thing to do, which you don't get in every setting. So that kind of drew me into pediatrics. So that was my goal coming out of school. And one of the things as physical therapists, it's very hard to get a job in pediatrics. Everyone wants you to have experience and come out of school with none. But I got lucky enough to get a job right away in peds in like an outpatient center. So I started there and worked there for about 5 years. And my boss and all my mentors there were all certified in NDT, which is neurodevelopmental treatment. So that's kind of where I got a lot of my practice and my experience when I was learning from them. Um, and I felt like the kids were making such a difference. And I loved how knowledgeable all my mentors were on the body and alignment and posture and how everything's connected and how it works. So that kind of drew me into wanting to learn more about it. So I went forward and did my certification, which it's a little bit different time to time. It was originally like an 8-week straight course where you go and you have time in the classroom and you learn a lot about NDT. Um, and then there's times like you're treating kids too that they bring in, so you kind of get that hands-on practice as well. I did it over like the course of 2 years. It just worked a little better with work, so that's how they're kind of offering it now. But I had a fly. I did it in Chicago, but I went for like a week at a time, flew home, then like a month later went back, did another week of training. So kind of learned a lot through that. And that's kind of where I specialize in my treatment. Um, and then from there, I kind of moved on and worked at the Smile Center with Damien and got to use a lot more of my NDT, which they also focus on as well. So it's been a great experience so far.
Um, Damien went from having PT in a hospital setting, and it always
Yeah.
felt very
Wait, hold
clinical,
on. To
and
go in, you ready
often
for the
he
special
would
ball?
get
Okay,
upset
and the
and
hammer?
cry.
Okay, so you gotta put
And
hands down.
when he moved to the Smile
Hammer?
Center, it just everything
Ready? I'll give
changed.
it to you once we're done.
And
Hands.
you
I'll
had
hold
this
these.
gift for
You
just
gotta put the
making every
hammer.
session like a game and fun. And it just made such a difference.
And I found, sorry.
Talk a little bit
Which
about
color
that.
do you
Like,
got? What color?
how did you find your way into that? You said you didn't even know you were going to go into
You want
peds, and I just feel like
a
that is
red
such
one, a blue one,
such a special part of your
a yellow
work.
one? Tell me the
How did you
color.
kind of how do you find that creativity? Talk us through like a typical session.
I thought we were gonna put one
Yeah,
more.
I mean,
Get the hammer
I
ready.
don't know where I found the creativity. I guess I
All done?
learned a lot
Yeah.
from
Okay.
my mentors and everyone that taught kind of me and kind of comes with it with practice, I guess. But one thing I've learned is that making it fun and keeping the kid engaged, I feel like they get so much more out of it. So I feel like you can be as knowledgeable and a great physical therapist, but if you can't do like that play and have fun with the kid, I just feel like they don't make as much of progress and they don't make as much change because they're not enjoying it and kind of they're not as invested in the treatment and everything that you're working on. So I definitely try to come up with like a play scheme and really tailor it towards each kid to make sure they're going to enjoy it and help them kind of like have a say in what we're working on. Like Damien, I feel like always knew what he wanted to do, where I know I have a specific child on my caseload right now that does not want to be in therapy, doesn't want to be there, but if they help me like come up with the activities that we're going to do and the games that we're going to play when we start and we kind of write out a schedule, I feel like they're a lot more invested and they like know what we're working on and we're participating in it. And I think they're getting a lot more out of it that way. Um, it's hard to say a typical treatment session. I feel like they're also different based on everyone's diagnosis. But based on the NDT approach and everything like that, I think the big thing is like really we do more of a problem solving approach. So I try to pick one thing that I'm working on that session. For Damien, a lot of that time we're working on walking. So I'll watch him walk into the session.
Okay, we gotta turn this
How much
corner.
assistance does he need? Is he using an assistive device? And really looking at like that quality of movement and then kind of making my treatment plan from there.
There, so we don't take it over.
So we
That's
kind
what I
of
was going to
do.
ask you. Is that part of is the games part of the NDT process?
I wouldn't say it's part of the NDT process. I think that part's more of just like working in pediatrics process. Um, but it's definitely like important no matter what type of therapy you're doing, I think to incorporate that to make the kids feel a little bit more engaged and more invested and just have fun with it because they also need to be kids.
Exactly. Yes.
And I think that's such a huge piece because developmentally, that's part of childhood development, engagement in play. And like I've seen so many of the videos and pictures that Jen has taken of Damien at therapy, and to
Mhm.
see him in his Halloween costume with his walker, running around the Smile Center, or, just the play that's involved, playing soccer and, doing those things that are used to improve his function. And for a child, play is part of their function.
Yeah. And I think a lot of that too, I mean, I've always done play in my treatment. Um, but especially at the Smile Center, I feel like I learned a lot working there as well. The clinic I was at before was just physical therapy. And same with where I'm at now, it's just physical therapy, but there's something nice about being at Smile and you get to work with like the speech therapists and the OTs and they're at Smile very into like the DIR floor time. So like going into Smile, I was like, I have no idea what this is. And more of that child-led approach.
What's
So I definitely try to like
DIR?
incorporate that in. Sorry, what was that?
DIR, what is that?
Um, I don't know what the DIR part stands for, but it's like that floor time approach. So Galit used it a lot. But it's basically more of like a child-led
Oh,
therapy.
okay.
Um, Harder with like physical therapy, not as applicable, but just seeing the speech therapist and the occupational therapist like use that kind of like helped me, I feel like, be able to like play and engage a little bit more too. And it helped me get the child to do what I wanted to do, basically. Where I feel like before I was like, no, we're going to do this. Like I have my plan and this is what I want to work on. But just giving them a little bit more input, I feel like goes a long way.
I know you do a lot of NDT. Do you incorporate other um, physical therapy, uh, what would you call them? Approaches?
Modalities?
Yeah,
Like,
modalities. Yes.
yeah, I feel like NDT is very like all-encompassing too. I feel like
I know, I'll get
if
you
you
a
like
box.
go back and look at the history, maybe it was a little bit more specific, but now it is a little bit more
Okay, it's
general,
down.
just kind of like a
It's on
hands-on
here.
facilitating approach, kind of to help children learn new movement patterns and move different ways and really focus on like their posture and alignment. Um,
Here.
so in that sense, I kind of use
Okay,
it
you
with
number one?
every child. And one of the big things with NDT now is that problem solving approach, kind of like we talked about. So
Want to get green?
kind of whatever I'm going to work on and breaking it down into different parts. So I definitely use that with everybody, even if it's kind of small or a bigger part.
Come on over.
There's definitely other techniques I kind of use here and there. My old boss was also like certified in kinesiotaping, and I know Huck at the Smile Center is as well. So Maddie and I had gone and taken that course together. So I do try to use like some kinesiotaping when applicable, which is basically just that therapeutic taping. I think we tried it one time,
Yes.
but it can kind of help facilitate a muscle to work in a certain way or kind of use it to inhibit a muscle so it doesn't fire as strongly. So sometimes I'll use that. We do definitely a lot of like swings and vestibular things, which is more of like that OT category, but I've learned a lot from the OTs that I've worked with. Um, and sometimes starting with like a swing to work on the vestibular system or help a child kind of feel a little bit more regulated definitely helps before like going into my typical PT session. So try to use a little bit from here and there.
Yes. I definitely have found that on the days where Damien had OT first, and when he has OT first, it definitely helps the PT session for sure.
Yeah, no, 100%. So I've learned a lot from them. And if we can't always organize the sessions that way, I try to do a little bit first just to help have a more productive like physical therapy session after.
Yes. And what are some of the things you're finding really challenging, like both when you're working with Damien and maybe, what's changed with your new job? Can you talk a little bit about that?
I feel like there's a lot of things. I think some of the biggest challenges are, and I don't know if we've faced this too much, but just getting children like the amount of care that I think they need. And no matter what setting I've worked in, whether it's like a private practice, like insurance based, or being at Smile and it's more through the Department of Education, I just always feel like I can never get that full amount. Like I think they need 4 times a week and they would really benefit from it, but someone always like fights back. So there's definitely a lot of like phone calls or letters to insurance to really like fight for that, or whether it's like EI or CPSC and really trying to like write those reports or fight for that extra visit or a longer session. So that's definitely tricky. And in terms of solving that problem, I don't have an answer, but I always kind of tell my kids, whether like now that I see them privately, like it doesn't hurt to go through the process, try to get it in school or try to get EI as well. And then you can continue to do this to supplement, but if you can get that extra care, that's even better.
Have any advice for a parent trying to advocate for additional resources? Any specific avenues or strategies that have helped, some patients that you have seen in the past obtain services when they were initially declined?
Um, I mean, insurance based, I would say a lot of the time the issue that we're having is like they want to send them to, like I think one of my kids right now just got denied because they want to send them to like an outpatient adult center. So like I think a lot of that is, we've had kids like go or call the clinic and then have them send letters of like why this isn't the appropriate setting. They don't have the swings and the games and the vestibular equipment to like really help have like the most productive session. Um, so that's definitely tricky. Getting on the phone and calling the insurance and really advocating, having the parents do it is usually pretty beneficial. And then in terms of school-based and CPSE, I feel like that's very hit or miss. I think really like gearing the reports and everything towards why they're not functional in school, because that's really what they're like looking at and how these limitations are affecting them on the playground or in the classroom, um, has helped kind of like get more visits because that's usually where we lose them, especially with some of my kids with CP. Like I'll be like, they need 4 times a week, but they're like, well, they're functional in the classroom. So like, yes, they need it, but this isn't the way, like you have to get it. So I think trying to just gearing it towards what CPSE and CSE is aimed to help with has helped get like more visits.
I feel like for myself, so many parents and this was me, right? When is he going to walk? When is he going to walk? Like walking is such a huge goal that every parent has and like he was walking because of you, right? Um but I wonder too, like, what are some of the other things you work on as a PT? You know, how can parents find that those, that patience of like, right now, I'm just trying to help him find his balance, or right now, I'm just trying to help him stand more effectively. Can you talk a little bit about that? Like, just what are some of the other focuses that you have, when a parent is so eager for their child to walk, but what are some of the other things that are really important that you're looking for?
Yeah, I mean, as a physical therapist, we're working on achieving all those gross motor milestones. So, like, depending on their age, doing the rolling and the crawling and sitting up by themselves, being able to transition in and out of standing, kind of getting that standing balance. And then, like you're saying, walking and stairs and climbing, everything like that. I think, especially if we kind of like focus on Damien, there's obviously walking was our main goal and we got there. Um, there's a lot of components that you need to walking, which I think sometimes a parent doesn't see as well as what we know we're working on, like you said. So as physical therapists, being able to like express that a little bit more. But with Damien kind of working on, he needs that range of motion in his legs to be able to take that step. So we always start with like a little bit of stretching. He needs to be able to do that like lateral weight shifting in order to unweight one foot and bring one forward. So I know when we first started, it was a lot of like cruising along the wall or cruising along a different surface. Doing a lot of like strengthening for his legs so he has the endurance and he has the balance in order to like walk forward long distances. So I feel like all those little exercises that we work on, even if he's sitting down and not standing up all the time, are really still geared at reaching that higher level milestone of getting him to walk forward.
I hear that a lot at Smile, bottom up approach.
Mhm.
And unfortunately, you see a lot of,
I'm watching.
doctors even just thinking that you should, keep working on moving him forward, just walk, 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 right? One leg in front of the other. And when you really, I was so fortunate to be in so many of the sessions and to be able to see these tiny little movements that you did over 2 years' time that really builds up the muscles, working on the core as well. So many different things that you need to be able to move forward.
Yeah. And I think a lot of that too is we could just say, okay, we're going to work on walking and we're going to practice it every day. But to get like the quality of movement that's going to help him over time, looking forward, like as he gets bigger and he's getting older and his legs are getting longer, like really keeping that range of motion and working on that quality is definitely important. So, like you said, there's so many little things to work on in order to get there and do it properly rather than just, oh, we're walking, but we're kind of bent over a little bit or we're not getting that good step length. So, just kind of putting it all together.
And the other challenge we found too was growing. Every time Damien would have a growth spurt, we'd take so many steps back. Can you talk a little bit about that too? Like, so parents aren't alarmed like I was when all of a sudden it's like, but he was just doing this and now he's crawling again.
Yeah. And definitely, I think a lot with Damien, we would notice it like every few months, like that growth spurt, and we'd see like little regression. I've definitely had it with like other kids as well, where they're just like even babies, all of a sudden they have a growth spurt, and you see like their torticollis or their head tilt come back because they're just trying to figure out their bodies again. Um, I think we work on that strengthening and we work on that range of motion and balance, and then all of a sudden we grow a little bit and our bodies are focusing on so many other things. So I can't tell you like exactly what it is, but sometimes like I think what was Damien working on? Maybe speech or feeding or something, and something he started to do really well with, and then we saw regression elsewhere. I think sometimes our bodies are just focused on one area, um, and we see a little regression somewhere else. But also even just getting taller, like our muscles are getting longer now. As they lengthen, we got to re-strengthen them again because they have to learn to fire in that new way. Maybe our legs are getting like a little bit longer, and it's kind of like figuring out how to move that new body in space too. Like different mechanics that we have to use. So sometimes we see a little bit of that regression, but I feel like the more we can strengthen and kind of keep working each time, it's easier to make it through that next regression.
Are there things parents can do at home? Are there any specific things that, I mean, always you're working with your doctor and your PT, but is there anything you can recommend for the parent that just feels like I want to do something? What are some safe things that we can do as parents to support?
Yeah. I mean, again, I think it's hard because there's so many different diagnoses and everyone presents differently. So it's hard to give like one exercise or something to do at home. Like you said, the doctors and the therapists are definitely giving activities at home. So I would say like trying to incorporate those as much as possible. Because the thing with therapy, I mean, some kids get it multiple times a week. Some kids aren't as lucky. Like we said, getting the amount of sessions needed is really hard. So sometimes it's just that 45 minutes once a week and it's great and it's beneficial, but there's so much other time throughout the day and throughout the week. So kind of working on whatever exercises like a therapist provides. Um, and then I think, like we talked about, just being a kid too. I think there's so many like adaptive classes or sports or activities that I've had kids do that are really, really great. And I think as a parent, trying to find some of those groups just so kids can socialize if they're not in school, kids can still get the physical strengthening and activity that they need with kind of like that one-on-one help. Like, there's like the adaptive rock climbing that we had talked about. I've had kids do like adaptive soccer that they have with like one-on-one coaches, but there's a bunch of other kids around too. So that's really great to like work on balance and coordination and just being like a kid and getting to do those gross motor activities that everyone gets to do.
And I think that's a really important piece because, like you said, therapy is a short period of time. So if the session is 45 minutes and there are so many other hours in the day, it's sort of like homework, right?
Yeah.
So you learn a lesson in school and then you go home and you practice the homework at home. So just reinforcing in the value that, you're not just going to progress through therapy alone, but therapy is the foundation, and then being able to have a parent who's engaged to support their child
Yeah.
and do that practice and repetition, and also finding those sports and activities that can also reinforce what you've learned in therapy.
Yeah. And I think that's it too. As a parent, like being that advocate and like asking your therapist, what can I do at home like this week? Like, can you give me one exercise for this week that we can really focus on and we'll practice it every day or every other day? And then kind of ask for a new one each week, kind of be on top of it yourself. Because as therapists, maybe they do have a lot of kids that they're treating and they don't always stay up to date with work on this at home. So kind of like advocating for yourself and asking what you can do to really supplement and make the biggest change.
It's also hard too as a parent when you're getting so much different information. Some therapists will say, yes, do this, others will say, don't. One of those things for us was the orthotics. Like in the beginning, we heard some advice to not use them, but then we found how beneficial they were. And part of it too was finding the right orthotist, which you connected us with.
Mhm.
Can you talk a little bit about AFOs and SMOs and how they support you and support the child with their walking correctly and having the right structure and all that stuff?
I think this is one of the areas that is like a bit challenging as a physical therapist too. Pretty much what we went through with Damien is what I go through with like a lot of kids. One doctor recommending like a certain orthotic, another one recommending nothing, and kind of having those differing opinions. So it's really trying to figure out what works best. And as a parent, I think you kind of have to listen to all those opinions and go with your gut. But so there's an SMO, which stands for like a submalleolar orthosis. So that's the orthotic that's going to come over your foot, and then it kind of ends right above your ankle bone. And that's really going to control stability like side to side in that medial lateral plane, like frontal plane. So like if the kid's collapsing on the inside of our foot, it's going to help lift up and kind of form that arch and also hold that ankle bone. I wish I had like a foot in front of me. So it doesn't go side to side. And then as we get higher, you can get that AFO, which goes over the ankle joint, and then it ends right above the knee. So it's going to do everything that the SMO does, and control that side to side stability, but it also kind of controls the ankle, bringing the foot up and bringing the foot down. So for children like Damien or some kids with high tone and some kids with CP, we have a hard time kind of lifting our toes up, and sometimes we'll walk and weight bear through like the forefoot and kind of put our toes down instead of our heel. So with him, the AFO really helped because it kind of helped keep that ankle in a neutral position. So that way we could get our full flat foot down as he's walking, rather than dragging our toes.
This is like so much wonderful information. Thank you. Final thoughts.
I mean, I feel like we covered so much. I'd say really as a parent, and I would just say make sure like you do, just advocate as much as you can. And I know you guys have tried so many different therapies and have so many different opinions, and I think that's great. And I think as a parent, you always know best. And as a therapist, we see your kids for 45 minutes a week, and we're very knowledgeable on one area, but kind of just listening to your children and what they say. I'm trying to think of a specific example, but I know like we've tried things with Damien, and maybe you can tell he's like in pain or something's a little bit harder, and maybe I can't like read those flags. So you know your child best. So just really always advocating for them. Trying so many different things. If you're trying one type of therapy and you're not noticing a change, try something else. Like it's not going to hurt. And if it doesn't make a difference, then you don't have to keep doing it. But I think just trying so many different things, can really be beneficial. And then just doing, like you said, as much as you can at home, because therapy is just a short period of time in that week. So the more you can practice and incorporate what you're working on in therapy, like throughout your week and throughout normal daily activities, I think that's always really beneficial.
Fantastic. Thank you so much.
Of course.
Just thank you for all that you do. And, you know, I was so exciting for me as Damien has matured and been going back and forth to therapy. Jen sees him every day. As a therapist, you see him a couple of times per week. I live about an hour away from them, sometimes 2 hours, depending on the day. So if I see him, you know, every other week, sometimes maybe I went a month without seeing him just to see that progress. So Jen might say, oh, yes, he's improving. But when I would see him, the improvement was so profound. And it's just really inspiring. And I think, you know, it should give hope, you know, to parents who are maybe uncertain about where their child can go and what the progress can be, and to just stay steady and know that these are things that work.
Right. Fantastic. So thank you so much, Meagan.